We've got your back.
Hey, Dr. Eric and Max, here to give you a little bit more insight into migraine headaches. The key thing to understand about migraines is that they are a neurologic phenomenon. Now, what does that really mean? Okay, well, the most common version of a neurologic phenomenon that you're aware of is a reflex. You go to the doctor finds a tendon, the doctor taps the tendon and your arm goes jump. Okay, well, there's a reason for that, but when you tap the tendon, what's happening is you're getting a signal that goes from the tendon to your brain that says someone's moving your tendon. Your brain responds like, don't do that, and takes the tendon back away from you. So that is a neurologic mechanism. It's all happening within the brain itself, okay, and the nerves that go to the brain. Now, migraines are similar also, as the causative tissue, the tissue that's really giving you the pain, is inside the brain there. And so consequently, it's really difficult to find effective medications that get into the brain and cause migraines to get better. It's also very difficult to get anything that's going to affect it on a structural level because it's not always consistently a structural problem. So the issue is, if it is a neurological condition that's triggered by things, one of the most important things you can understand if you have chronic migraines is to how to manage your triggers. So I would say the most common one I see clinically that is oftentimes ignored is simple dehydration. People oftentimes will come in and they'll have a headache, give them 2 glasses of water and half an hour to sit there and the headache's gone. And all it took was the water, okay? Because their body is literally dehydrated. We drink so much fluid that it's got chemicals in it and artificial sweeteners and flavors in it. Sometimes we kind of forget to just hydrate. And sometimes waters that we drink that we think are healthy, like coffee or tea, are actually diuretics that make dehydration worse. So dehydration is a big one. The other one is getting away from light, getting away from sound. Some people that are a migraine, they're getting one or they're about to get one. They really need to get in a situation where they can control their light and their sound. And that can be really difficult, like if you're doing something like driving a car, or you're in a business meeting, or you're doing something that's important. So I always suggest to people when that's happening, the more that you can kind of structure your life in a way that you can grab 10 minutes and try and break it. I've even had patients that have had great success going to the bathroom and deep breathing and having a glass of water. It's gross to drink in the bathroom, but people do it. And, do that kind of self-care while they're in the stall, literally, in order to have a migraine for the rest of the day. So in the next video, we'll talk a little bit, we're kind of going to wrap up this series. We're going to talk a little bit more about migraines and the triggers, but we're also going to talk about tension headaches and different home remedies for those. So look forward to seeing you in the next video.